Come up and volunteer to talk for a second. Such an amateur video. I don't know. Okay. Hey, this is Dr. Rutledge, and this morning we're talking about my concern about a finding that a lot of patients have been telling me about, and that is that after the mini gastric bypass, they are showing up with the signs and symptoms of gluten insensitivity, also known as celiac disease. The idea behind this is that there is a protein in wheat that can cause an allergic and damaging reaction to the lining of the gut and be associated with symptoms like gas and cramps, abdominal pain, diarrhea, and things like that make you feel bad, even including skin rashes and other complications. We have a number of patients post-op who suffer from what we would call, in general, dyspepsia. Now, dyspepsia is just a word that means upset stomach. And we've wondered in the past what causes this. The majority of patients, we assume, who have an upset stomach after the MGB have gastritis or an ulcer. But a number of our patients who have this upset stomach have an endoscopy and they don't find that they have an ulcer or gastritis. Yet they are still suffering from cramps and bloating and diarrhea and pain and nausea and vomiting and things like that. So one of the things we've been wondering about is, could some of our patients be having either an unrecognized that they had gluten insensitivity pre-op, or that the MGB itself may uncover gluten insensitivity because of the surgery and the bypass itself. So we're looking into that more. We're actually going to be doing a survey. We'll be doing an analysis to look for how frequently people are doing this, so pay attention when we send out the email for the survey to fill it out for us. But this morning we've been talking with several of our post-op patients, and they said they would volunteer to talk a little bit about gluten insensitivity and celiac disease. And one of our, I guess, our most knowledgeable patient is a patient who had the surgery, was gluten insensitive pre-op, and has managed her post-op recovery by remaining on a gluten-free diet and has had a good recovery. And maybe if you could give us, for a few minutes, a little background about that. Do you mind? All right, come on up. And maybe to start off with, you could introduce yourself, just your first name, a little bit of background about your MGB and the gluten a little bit.
Yeah, my name is Kelsha, and I had the MGB a year ago. And before that, I was gluten-free, eating a gluten-free diet. And I always heard people talk about having weight loss surgery and having a hard time with carbs, and particularly breads. And I wasn't experiencing that really after my mini gastric bypass. And so I started wondering if it was because I was eating gluten-free pastas, gluten-free bread, gluten-free cookies, gluten-free cake. Anyway, so I was eating those things and I wasn't having that hard time, and anytime I would start to get a little bit of acid reflux, I would use carbs to push that down, I guess, is a way to word that. And anyway, for a while after surgery, I did go off my gluten-free diet, and it was very painful, and it wasn't a good thing. So when you ate gluten after surgery, you would get symptoms. Oh yeah.
Can you describe the symptoms?
It was what everybody talks about, the rock settling in your stomach, the expansion feeling,
bloating,
dumping,
diarrhea.
Yeah, that was when I would have the hard time. It was actually more of a constipation problem. I didn't have a problem with constipation after surgery until I wavered on my gluten-free diet. And so, yeah, that's what I've discovered. And when I eat gluten-free, I'm fine.
Those symptoms go away.
Yes.
And you feel good.
Yeah. And
okay, now we talked to your dad. And he's going to tell us a little bit about his experience. He's not gluten-free,
no,
but you've been suspicious. Is that what you were saying?
Yeah, actually me and my mom both have been on the gluten-free diet, and so my dad and brother have not wanted to join us in that kick. But
we're going to talk to them this morning. Maybe we can convince them. Right?
All right.
Any other advice on is it hard to be on gluten-free?
No, you know, we are so lucky nowadays to live in a world where we have so many products available to us. I think the world has really caught on that a lot of people are gluten intolerant, and
yeah, there's some study, I think it may be over 2 million Americans may be gluten sensitive.
Yeah.
Do you understand the problems and how the disease works? Can you give us a quick summary of, do you understand what's going on, why gluten bothers people? And
I know that it inflames you. I know for me personally, it affects my skin, it affects going to the bathroom, it can make me lethargic when I'm eating a bunch of wheat. So those are the things for me personally that it does, and I know that having an inflamed body is not good for you. That's obviously shutting down organs and stuff as time goes by.
There's a book about it we saw, it's called Cereal Killers, for cereal, but not S-E, but C-M.
Yeah.
So it's bothersome. All right, can we, now Dad, would you say a word about, you don't know about gluten-free, but you're just going to talk about your experience eating some of the foods that might have wheat. Do you mind saying a word? So we'll give a background introduction, your first name and when you had surgery, and a little bit about your MGB first.
Sure. My name is Paul. I had MGB surgery September 30th, 2009, a little over a year ago. And since the surgery, I've lost 130 pounds. I'm no longer diabetic. I'm no longer have sleep apnea. I no longer have high blood pressure. And wonderful blessing in my life. But as far as this gluten-free issue, my daughter and my wife have been eating gluten-free for quite some time, and it's helped them a lot. I can tell it's helped them a lot.
And what we were talking about, I think, before we started the video, is you said that certain things right now you have trouble with, like cereal. I said to eat Raisin Bran, and
I used to love Raisin Bran. It was my favorite breakfast cereal to eat. Since the MGB, if I try to eat it, I am so miserable. I do have a lot of abdominal pain. I get a tremendous amount of gas. I do have diarrhea with it, and so I don't eat Raisin Bran anymore.
So prior to surgery, wheat-based or Raisin Bran cereal was no problem.
Right. It was.
And now afterwards, maybe, if it is a gluten sensitivity, it may be that in your case, possibly, we may have caused or opened up or exposed you to this Raisin Bran type problem because of the surgery, maybe because you didn't have.
We weren't going to say brand, say brand name.
Oh no, there are all kinds of Raisin Brans, aren't they? Or is there a special?
That's right.
I didn't mention any company, did I?
That's right. You didn't. Yeah, and breads also. I pretty much stopped eating breads. I used to be quite a Subway sandwich fan.
Right.
Oh, excuse me, I mentioned the brand, but I love Subway still. Okay. But I go in.
We love Subway.
I go in now
for legal purposes. We love Subway.
I go in now and I order their sandwich in a bowl, and it's a really neat thing. They're very accommodating. One of my favorites is tuna. They take a bowl and they put the lettuce in there, and everything that you could get on a sandwich they just put in a bowl, and I eat that, and it's wonderful. But if I try eating their bread or anybody's bread, any bread at all.
So let's see, let me interrupt you because you're going fast, but I think you said something really important. So if you eat a sub sandwich, not necessarily a brand,
very good,
but a sub sandwich
any sandwich
with white bread, for example,
white or wheat,
but you will have some symptoms afterwards that are unpleasant.
Oh, very much. So.
And again, the symptoms are
a lot of gas,
bloating. So you'll notice your tummy will cramps, or pain, discomfort
yes,
at all?
Very much.
Yeah. And if you eat the same sandwich fixings without the bread, you won't have that problem.
Correct.
Okay. But even though you've seen your daughter and you know your daughter is gluten-free, you haven't tumbled to the fact that you should be gluten-free. Is that true?
Correct.
Okay. And now your son. Is that okay?
Yeah.
Do you mind? Yeah. Okay, let's see if we're... Yeah, okay, so maybe just first name only.
My name's Laurel. I'm also a year out from surgery. I was 334 before, and I'm 167 to 170 now, so I was wearing size 42 pants. Probably should have been 44s because 42s were pretty tight. Now I'm 32.
Okay, so now we were talking about this that certain foods can bother you. Now, and breads bother you, is that true?
Breads do. They bother me pretty bad, but again, I'm a person, I love bread so much that I can't bring myself to not eat it.
Right. So that means you're doing the experiment, you're repeating the experiment every day, or not every day, but frequently. So you say, I would love to have a sub sandwich or a roll or something like that, and when you do, you get some of these same symptoms or not?
I get terrible, terrible pain in my gut sometimes.
Really?
And when I'm driving my truck, I'm out there, I'm sitting, and all I want to do is stand up or lay down and get rid of this pain. And
because you have these crampy pains.
Yeah, and it's killing me, but I keep eating the bread.
And you're... That's great. This is, I just want to say, guys versus girls, okay? That is what I would do. I could just, that's 100% guys.
That's a good question. That's what let's ask them.
Yeah.
How many people can eat Mexican? How many people have a hard time with Chinese? Yeah, all the wheat in it. Is it bread in it, flour?
Like the mushroom chicken though has a lot of salt in it.
Another symptom I have with wheat is sinus pain, sinus infection. It causes serious sinus pain, the worst sinus pain I've ever had in my life.
Would you be willing, having thought about this a little bit, to have the same food in a different kind of bread, which is made from rice, or there are certain breads that are gluten-free, right?
Yeah, rice, potato, sprouted grain.
Sprouted grain?
Like sprouted corn.
If we could get you different kinds of bread and try it, would you be able to email me back and try a different kind of bread?
Gluten-free crackers. It's not the same.
Yeah.
So you might be willing to try it for us? Okay.
You really do get used to it too. People always say, "Oh, it's gross," but you adjust your taste buds and then you move on with life, and it's fine. And
well, and you said if I can have my Mexican tacos if I have them with a corn tortilla, but I can't have them with a flour tortilla.
Life goes on. You know, there's worse things than not being able to have a flour tortilla.
I could go to a corn tortilla and still eat Mexican.
Even like at Del Taco, right? During the chicken soft tacos?
Yes.
They come on a flour tortilla. Ask them for corn. They'll give you corn.
Okay, so Del Taco is now back on our list.
Very good.
Did we say that we love Del Taco? Maybe we'll get a sponsorship if we keep trying this. Good. Okay, well, thank you. Let's see, so who else? Were you going to say a word? Do you mind?
Yeah.
Do you mind? Okay.
I have a question though.
Yeah.
Can you guys do the gluten-free beer?
No. There's no beer. Cheers out.
They can't drink it all. You better tell him that.
Okay, I will.
Do you do gluten-free beer?
So, my name is Joe. I had surgery October 7, 2009. I've lost about 152 pounds. I was just right at 360. I'm now about 206. My belt size was a size 50. My waist, I've lost about 19 inches around my gut. So we talk about this whole thing with breads and meats, and you know, like from a cereal perspective, you know, you also have issues with lactose intolerance. So from just having milk with like Raisin Bran, for example, might be an issue. But I switched to, you know, like your lactose-free, your lactate milk,
right?
And that was great because it tastes like, if anything, it's a little sweeter than regular milk, I think. But you know, I can even take it with my kids, and they don't know any difference. So that, you know, it's milk. Right. So
and just as an aside, while we're talking about it, there are some foods that cause problems after the surgery. One of them is lactose, and lactose in a person who doesn't have the enzyme lactase to break it down can cause the same group of symptoms: gas, cramps, pain, diarrhea, problems like that. And so if we have a patient who's having those symptoms, think of eliminating dairy, lactose, or adding the lactate enzyme to get rid of that sugar, that lactose sugar.
Yeah, so for me, finding, you know, the lactose-free milk was huge, you know, because I love cereals, but I found out that I can't, anything that has a wheat product in it, you know, whatever it be.
No brand names.
Right.
No brand names.
I could go down the list, but I mean, I've tried plenty of them, and I have issues, but if it's a rice-based cereal with milk with sugar on it, or even if it's a sugar-based rice cereal, I have no issues with that.
So I'm going to go over that one more time because I think that's so telling. Now, do you know about gluten insensitivity and all this stuff?
From talking to Kelsha and Carrie up in Canada.
Okay.
Yep. You know, so having those discussions back and forth.
As we used to say in the 60s, she turned you on to gluten insensitivity. Is that right?
Yep. So, you know, and then there's been...
You're a pusher of gluten-insensitive foods.
There's one gal that was, you know, in one of the forums talking about having a revision because she was just having such bad gas, and we started going through her diet, and she has like 5 pieces of toast every morning. Yeah. It's like, you know, for me that'd kill me, you know, and, you know,
is that
so
right for you too?
Just, I mean, bloating and just, you know, the gas would be, you know, it's
okay, so I want to do this again. I'm going to cut this piece out separate and see if I got it. So you had the surgery and doing pretty well.
Great.
But you noticed some foods, in particular cereal, with a wheat component.
Breads as a whole.
So breads, which most breads are wheat breads, right?
They're made out of some kind of wheat, enriched or bleached.
Right, so most breads are wheat-based. And so if I hear you correctly, when you eat a piece of bread, you're going to have trouble.
Yes.
And you noticed that after the surgery.
Yes.
Now here's my question. Did you have that problem prior to the surgery?
Not a bit.
Okay, so what we're saying, I think, what I'm hearing this morning is that the MGB caused gluten insensitivity in him, and in him, and in you. So here's the thing, and I didn't know that, and I haven't been counseling my patients enough about this information. That's why we're doing the video this morning. We want to pass on that. Let's imagine one of our patients is suffering, like you said, with cramps or diarrhea or bloating, or those are the kind of symptoms you might get with when you eat bread. What other symptoms did you notice that our patient should look out for? Anything you can tell them?
Well, I mean, you end up with far looser stool than you would normally. That would be an effect I'd have.
Right, so people are suffering from diarrhea or, what's that?
The dramatic size constipation.
So first of all, you're constipated, and then you have diarrhea, and then you can't, then it's cramping, and you're bloated, all kinds of unpleasant symptoms, right?
So I don't, you know, like for example, if I have like pizza,
yes,
the thinnest crust pizza I can have
is better.
I love it. I don't have any.
But how about thick crust pizza?
No way.
It bothers you.
Oh, huge.
Okay. And pre-op. Before surgery, you could eat thin and thick crust pizza. It wouldn't make any difference.
Not a bit.
So what we're saying, I think, is that the MGB has brought on this gluten insensitivity in your case.
It certainly affects me, yeah.
Yeah. I think that's what we're saying. And that's what I think we're seeing, and I want to tell other patients about that. Good. Do you want to talk for a second?
Sure.
Do you mind?
I don't care.
Okay.
I'm kind of shy.
Well, you don't have to if you don't want to.
I'm a little shy. Hi. I'm Renee, and I had MGB a year ago on the 7th, and I've lost almost 140 pounds.
Woohoo!
You were prior lap band.
And I was a prior lap band. Yeah.
Oh, no kidding! I forgot that.
Yeah, you took out my lap band. You saved me.
Oh.
Yeah. So I have the gluten issues.
Now, did you have that pre-op?
No, not at all.
Okay, so before surgery, you could eat whole wheat cereals and whole wheat bread?
I could and did eat anything and everything.
I like how you said...
In large abundance. That's why I'm here.
Okay, all right, I got you. You don't seem shy.
I'm shy.
Okay, all right.
Yeah. So, yeah, when I eat bread, which I do, I get the gas, and it's toxic. Like, I can clear the house. So when I want peace and quiet, I do eat bread.
I think we should work out another way to talk with your family.
No, it works good for me.
All right,
I like my bread.
Okay.
But I get this thing where I, like instantly my best friend, she's like, oh my God, you had a gas baby because I eat.
Your
and
stomach
like,
is distended. Yes.
It's bad. And she
can see it. It's so obvious that somebody else can see it.
So we always talk about my gas baby because we know it's when I eat bread.
And it's when you eat bread.
And then I also get this weird rash. I don't know if you can see it.
You get a rash? And it occurs after you eat wheat bread.
Yeah. I drove here overnight, in the middle of the night, and I ate pretzels all the way here. And Like
And that's
right away.
Yep.
Right away.
Yep.
Yeah, it's there.
Are you going to clear the room? Should we like...
I might.
Is there a pretzel alert we should pass out?
There's no guarantee. And I'm also an Agent Orange sufferer.
Now, is that worse or better with certain kinds of foods?
You know, chips.
Yep.
If I even eat like 3 or 4 regular potato chips,
Yes.
it's bad.
Right.
And the phrase is never trust a fart, you know? You just don't trust them.
You got
Yeah.
potential problems. The other way would be to stay away from potato chips, but you don't.
You know what though? I've done that, and there's other foods. I mean, I eat a lot of healthy fats.
Oh, healthy. Well, all fats are going to be problematic.
Yeah, and all fats give you a different color.
Yeah, thank you for sharing. Okay, good.
So it's
Now, one of the things you
Agent
can do...
Yellow, Agent Brown, Agent Green.
Right.
I mean, you got all these agents,
Yeah.
so I'm just warning you guys.
Agent Fuchsia. Okay, let me interrupt you there. That was great news. But one of the things you can do for that is take a lot of fiber with it. The fiber will tend to help
But the
manage
fiber, it has gluten.
No, you can get non-wheat fiber. Citrusol is basically cellulose.
Okay. But doesn't that have a lot of sugar?
No, citrusol you can get without sugar.
Okay.
Citrusol is basically cellulose paper.
Okay. I was a bad patient and I didn't do the citrusol.
But we might help you and the family too.
Well, I don't care about the family.
Okay,
But I do. I'm like him, and it's not just a guy thing. I like my bread.
And so you just eat it. What the heck? Okay. Well, I guess thank you very much. I'm not sure that we'll have to cut you two out of the case.
Your office is a truck by yourself. Mine is a room full of people. It doesn't work for me.
You were going to talk about your bread. Do you mind? Okay. So we have one more bread. And anybody else that are going to tell bread experiences?
I'm Barbara. I had my surgery October 1st, 2009. I went from 210 to I weigh 128 right now. I went from size 22 to size 8. And I was also diabetic, really bad. 7 different medications plus insulin. I don't take any of that. Had high blood pressure, high cholesterol. Don't have any of those anymore. I don't do really well with bread. I stay away from like sandwiches, and if I do order a sandwich, I don't eat the bread. I eat the stuff inside. I remember when we had the our clinic, and you were talking about, you know how an MGB person eats a sandwich, you open the bread and you just eat the inside. And I always remember that when I eat my sandwich, because I only eat the inside. If I eat bread, it gives me a lot of gas.
Well, that's what I wanted, if I could interrupt you then. So this morning we're talking to people who've had trouble with wheat, and I guess almost all breads are wheat bread. Okay. So that when you have eaten bread in the past, can you describe what kind of symptoms you expect are going to happen to you?
I get cramps.
You'll get cramps? Will you get bloating?
I get bloated, and I got gas.
And
really
gas.
bad.
Okay.
So I learned just to stay away from
So you avoid them?
Yeah.
Okay.
And I
Now-
haven't had cereal in over a year.
And you don't eat cereal for the same reason?
Right.
And have you tried rice-type cereal, like a Rice Krispie-type cereal?
No, I
So
haven't,
will,
but
can
now
I
I'm
ask
going
you a
to
favor?
try that.
Right. I'm going to ask everybody this morning to help me and to help our other patients, those of you who've had trouble with cereal, if you could try a rice cereal, and then if you want to be sure you could try a wheat cereal, just to compare. So, and then if you'll email me an educational tool. Now, one other question I want to jump in before I pass on to the next thing is, did you have any of those problems prior to your MGB?
No, because I could eat, you know.
Right, you could eat sandwiches
anything.
normally.
Right.
So what we're
Right.
saying, I think, in your case, and I think we've heard this morning, is a lot of times the MGB uncovers gluten sensitivity in our patients after the surgery, which has not been on my list of complications, not been in my knowledge that we had this. And we thought basically bread was just a volume kind of thing. We didn't know that it was the gluten irritation of the lining of the stomach and the celiac disease itself. And so in your case, I don't think until you came here this morning you knew that that could be a possibility.
No, I didn't.
Yeah.
You know, I just thought, because when I eat bread, it feels like there's like something
Right.
stuck here.
It feels full.
Yeah.
Yeah. And that's all we thought about bread. Now we're maybe learning, maybe that the MGB has in 1, 2, 3, or 4 people uncovered gluten insensitivity.
Right. So I'm going to try the gluten-free bread and see how that.
And if you will, you're going to promise you'll
Yes.
send me an email. Let me
Yes,
know.
I will.
Okay. And if you don't mind, when you send me an email, if you'll send it to the group, we might be able to help a couple other people that are suffering from the same problem and just didn't know about it.
Right. Okay.
All right. Thank you all. Thank you very much. Yeah.